Understanding pelvic floor dysfunction, causes and symptoms. Pelvic floor dysfunction is a topic that often remains unspoken, but its impact on an individual's quality of life can be profound. In this comprehensive guide, we will explore the causes and symptoms of pelvic floor dysfunction to shed light on this common but often misunderstood condition. By understanding the intricacies of this condition, individuals can seek early diagnosis and appropriate treatment, ultimately improving their well-being. Introduction. Pelvic floor dysfunction is a condition that affects many individuals, yet it remains relatively unknown to the general public. This lack of awareness can lead to delayed diagnosis and treatment, which can have detrimental effects on one's health and quality of life. This article aims to shed light on the causes and symptoms of pelvic floor dysfunction, emphasizing the importance of early intervention. What is pelvic floor dysfunction? The pelvic floor is a group of muscles and tissues that form a supportive structure at the base of the pelvis. These muscles play a crucial role in various bodily functions, including bladder and bowel control, sexual function, and support of pelvic organs. Pelvic floor dysfunction occurs when these muscles and tissues do not function properly. Causes of pelvic floor dysfunction. 1. Childbirth. Childbirth, especially vaginal delivery, can lead to stretching or damage to the pelvic floor muscles, increasing the risk of dysfunction later in life. 2. Aging. As we age, natural wear and tear on the pelvic floor muscles can occur, making them less effective in maintaining proper function. 3. Obesity. Excess body weight can place increased pressure on the pelvic floor muscles, leading to dysfunction over time. 4. Chronic constipation. Straining during bowel movements due to chronic constipation can weaken the pelvic floor muscles. 5. Surgery. Certain surgical procedures, such as those involving the pelvic area, can damage or weaken the pelvic floor muscles. 6. Heavy lifting. Regularly lifting heavy objects without proper technique can strain the pelvic floor muscles. 7. High-impact sports. Participating in high-impact sports can lead to repetitive stress on the pelvic floor muscles, potentially causing dysfunction. 8. Genetics. Some individuals may have a genetic predisposition to pelvic floor dysfunction, making them more susceptible to its development. Statistics and research findings support the association between these causes and the prevalence of pelvic floor dysfunction. For instance, a study published in the International Urogynecology Journal found that nearly 25% of women experience pelvic floor dysfunction, with childbirth being a significant contributing factor. Symptoms of pelvic floor dysfunction. 1. Incontinence, urinary and/or fecal. One of the most common symptoms is urinary incontinence, which can range from mild leakage to complete loss of bladder control. Fecal incontinence, though less common, can also occur. 2. Pelvic pain. Individuals with pelvic floor dysfunction may experience persistent pelvic pain, often described as a dull ache or pressure in the pelvic region. 3. Sexual dysfunction. Difficulty achieving or maintaining an erection in men, or pain during sexual intercourse, in both men and women, can be indicative of pelvic floor dysfunction. 4. Constipation. Chronic constipation can be both a cause and a symptom of pelvic floor dysfunction, creating a vicious cycle of discomfort. 5. Frequent urination. Frequent and urgent urination, even when the bladder is not full, is another common symptom of pelvic floor dysfunction. 6. Pelvic organ prolapse. In severe cases, the pelvic floor muscles may weaken to the point where pelvic organs, such as the uterus or bladder, drop out of their normal positions. These symptoms can have a significant impact on an individual's daily life, leading to embarrassment, discomfort, and a reduced quality of life. Who is at risk? While pelvic floor dysfunction can affect anyone, certain demographics and groups may be at a higher risk. Women who have given birth vaginally, individuals over the age of 50, those who are overweight, and people with a family history of the condition should be especially vigilant about recognizing potential symptoms. Diagnosing pelvic floor dysfunction. Diagnosing pelvic floor dysfunction typically involves a combination of physical examination, medical history review, and, if necessary, imaging tests such as ultrasound or MRI. A thorough evaluation is essential to determine the severity of the condition and develop an appropriate treatment plan. Treatment options. Treatment options for pelvic floor dysfunction vary depending on the severity of the condition. Some common approaches include